Let's dive right in. Hitting the big 50 here in the US is a fantastic milestone, but it's also a real turning point for our health. The playbook for preventative care shifts pretty significantly. We have to start looking out for things that develop completely under the radar. I'm talking about silent conditions like heart disease, diabetes, or even subtle changes in your thyroid. You aren't going to feel these day to day. But here's the really good news. A handful of incredibly simple, routine blood tests can catch them super early. It puts the power right back in your hands. And listen, we're not just guessing here. The 5 blood tests we're going to look at today are deeply grounded in trusted, established guidelines from both the American Heart Association and the CDC. They literally design these recommendations to help you spot potential issues way before they ever turn into actual problems.
All right, let's look at test number 1, the lipid panel.
So you've probably had a cholesterol test before. Well, the lipid panel checks your total cholesterol, but more importantly, it breaks it down into the key players in your bloodstream. You've got your LDL, that's the bad kind you want to keep low so it doesn't clog up your arteries, and then you have your HDL, the good kind that basically acts like a cleanup crew for the bad stuff. It also checks your triglycerides. Now, why does this matter? Because this is the exact tool doctors use to estimate your 10-year risk of having a heart attack or a stroke. If your overall risk is normal, getting this checked every 4 to 6 years is usually plenty. But if you're managing high blood pressure or have other risk factors, your doctor's going to want to keep a much closer eye on it.
So here's your takeaway. Ask for a lipid panel. It could absolutely save your heart. It's such an easy thing to bring up at your next appointment, and it has a massive payoff.
Moving right along to test number 2, blood glucose and hemoglobin A1C.
Okay, so there's a vital difference in how we look at blood sugar. A standard glucose test is just a snapshot, right? It tells you what your blood sugar is at the exact second they draw your blood. Helpful? Sure, but it doesn't give us the whole story. The HbA1c test, on the other hand, is like a 3-month movie of your blood sugar levels. It averages them out to give your doctor a much clearer, big-picture view of how your body is handling sugar long-term. This is the absolute gold standard for catching prediabetes and type 2 diabetes. In fact, the CDC strongly recommends getting this checked at least every 3 years once you cross 50, and again, more often if you have known risk factors.
Think of it exactly like this: HbA1c, a 3-month report card for your blood sugar. It's an essential metric for your long-term vitality.
Next on our list is test number 3, the Comprehensive Metabolic Panel, or CMP.
Now, the CMP is essentially like checking under the hood of your car. It's an incredibly broad screening tool that checks 14 different substances floating around in your bloodstream. We're talking electrolytes, blood proteins, and key waste products like creatinine. By looking at all these pieces together, it tells us exactly how well your kidneys and liver are doing and whether your overall metabolism is perfectly balanced. And honestly, the best part, if you're on Medicare or most private insurance plans, they usually cover this exact panel without a fuss during your annual wellness exam. It's completely standard, very easy, and gives you a wealth of knowledge.
So remember this, CMP, kidney and liver health all in one tube. It's a fantastic way to get some serious peace of mind.
All right, continuing our journey with test number 4, the complete blood counts, or CBC.
The CBC is all about the fundamental building blocks of your blood. It counts up your red blood cells, your white blood cells, and your platelets. Now, you might be wondering, why does this matter so much as we get older? Well, it spots incredibly common hidden issues, like anemia. Anemia actually affects a ton of older adults and can cause this profound, completely unexplained fatigue. A CBC is also a great early warning system for infections, certain blood disorders, or even some cancers. It's a really powerful baseline, and doctors almost always order it once a year at your routine physical.
Keep this actionable thought in mind. CBC, a simple check for hidden issues.
And that brings us to the 5th and final core test, thyroid stimulating hormone, or TSH.
I really cannot stress this one enough because our thyroid function can change dramatically as we age. This is especially true for women, but guys, don't tune out because it absolutely affects you too. People will get these vague symptoms, right? Just feeling completely wiped out all the time, unexplained weight changes, or constantly feeling cold. And what do? They just brush it off. They say, oh, I'm just getting older. No way. Never ignore those signals. A TSH test will show you exactly if your thyroid is overactive or underactive. A lot of experts actually recommend this test for all asymptomatic women over 50 and for absolutely anyone experiencing these kinds of red flags. So remember this. TSH, don't blame aging until you test. Empower yourself with the facts instead of just living with the fatigue. Okay, now that we've nailed down the core 5, let's pivot for a second. Extra tests to consider: gender and generation specifics. We're going to move just a bit quicker here, but these are a few highly tailored care options that go beyond those standard tests. First off, for the men, it is absolutely critical to talk to your doctor about the PSA blood test to screen for prostate cancer. It is a vital early detection tool. And for everyone, particularly if you were born between 1945 and 1965, the CDC highly recommends a one-time hepatitis C test. It's just a simple blood draw, but it could quite literally save your liver. If you fall into that generation, make sure you ask for it. Okay, let's wrap this all up into one neat package. Here is your ultimate wellness checklist: the lipid panel, the HbA1c, the CMP, the CBC, and the TSH. These 5 tests take all the guesswork out of the equation and give you real, hard data about your body. I'd strongly encourage you to literally write these down or take a picture of the screen right now and bring this exact list to your next checkup. So, I'm going to leave you with this one final, provocative question to think about. Will you know your numbers? I want to warmly remind you that knowing your numbers is the absolute first step to staying strong, vibrant, and healthy after 50. Thanks so much for joining me for this explainer today. Take care of yourself out there.
Oh, there are so many yummy vegetarian options out there. You could try like lentil soup, veggie burgers, tofu stir fry. The possibilities are endless.